Anyone else, comments or concerns on this topic? Representative Hamilton.
Excuse me. Thank you, Mr. Chairman. I have, I guess I'm moving off of the testing. Is that appropriate, or should I wait?
Sure. What's the topic? We're going to move on to the next piece. Is really about if it's not about the update, the legislation, and really the next topic is going to be kind of what are the outstanding issues. I know you're at the forefront of outstanding issues as we talk about those things that have had a negative impact as from the implementation of the plan and participation in the plan as it refers to rights. So is that what you'd like to do?
Okay. Yes, if I could, Mr. Chairman.
Yep.
So for those of you, I'm Representative Rod Hamilton. I represent District 22B, the southwestern part of the state. I have multiple sclerosis. A couple of years ago, I actually enrolled into the program. My specialist is with the Mayo Clinic, and so they actually wrote the prescription. I toured all the facilities. I was very impressed with the professionalism, the safety, the security with both facilities. And right after the department helped me enroll into the program, I was notified. The ATF sent out a blank statement back in 2000, or excuse me, a statement back in 2011, I believe it was, that this is a controlled substance, and anybody who enrolls in the medical cannabis program would therefore lose their Second Amendment rights. I could no longer purchase ammunition, have gun ownership. I could not renew. I had a permit to carry. I could not renew my permit to carry because I was straight up, open and honest with everybody. I never even filled my prescription. I'm no longer enrolled into the program because I want to change the law, and before I move forward once again. And so you think about it, this is still a Schedule I narcotic in the eyes of the federal government. We are all criminals in the eyes of the federal government, and this is wrong. I've heard the stories from people who are receiving very great benefits from using this product for medicinal, well-being, if you will. And it's very unfortunate that we are, once again, we're all criminals. I know for a fact there are people driving across state lines purchasing this because people have approached me because it is cheaper. So that's taking place. They are criminals. And so my question would be to everybody, what are we doing, or what could we do to put pressure on the federal government to change this, to at least get it changed from a Schedule I to a Schedule II or something like that? I'd like to hear from people who are working in other states as well. What can we do? Because like I said, I lost my Second Amendment rights. I'm not in the program. I never filled my prescription. I would really like to see if this could help my condition. I suffer from muscle spasms and spasticity and pain as well. But again, well, I'm going to stop there, Mr. Chairman. What can we do to help change this so that we are not all criminals? Thank you.
Thank you, Representative Hamilton. And I think that's the very component of the latter half of this conversation is about what are those known issues where we put people into conflict with current law enforcement, yours specifically with a right, and as well as when we look at, I think the whole, over the summer, it's been about a conversation of possession. What does that look like relative to a very dangerous pharmaceutical and widely accepted and intoxicating painkiller, whatever that would be? Those are fine. And so this is the very purpose of the conversation, to look at and see, how do we make sure that we don't put more people in compliance and routine using a prescription legal drug in Minnesota, just happens to be cannabis based. And so we would seek open input. I know Representative Gomez, Representative Munson, and yourself, but there's a whole bunch of people that have a list. This is why we're going to have the conversation. I would like input from anybody that has a more national, because everybody is in the same boat from a federal government still scheduling as a Class 1 narcotic. So seek open input from anybody. I think we see Representative Kings, or I'm sorry, I don't mean to demote you there, Mr. Kingsley, but Mr. Kingsley, if you would like to add some comment, and we'll seek any comment from any additional people who have experience in the other states as they've addressed these issues, and have they been able to do it successfully?
Yeah, Mr. Senator, so I've been fortunate enough over the last year plus to sit on the United States Cannabis Council, which is a group of, I think it's approaching 100 different companies now that are lobbying on the federal side for meaningful change. Mr. Hamilton, the kind of the issues that you state really do require federal change. And as many of you may know, there's currently sort of a logjam of various competing proposals on the federal level. There's a sort of there's some comprehensive legislation. There's some more focused stuff that may or may not get through this year, and there's also some competing Republican legislation that could pass as early as next year potentially if we get a change in the House of Representatives and Senate. So my best guess is that we do not see federal change, which is a major impediment to the issues you've described this year, and it could be 2 to 3 years out before we see that. Others are more optimistic, and I'd be curious if Gina has any national insights.
Sure. I mean, I think I'm in line with you that no federal change is expected this year, 2 to 5 years from now, depending on how things evolve in Washington D.C. But for the time being, I think it's status quo.
Thank you, Ms. Roman. So no other states have made a significant progress in either directing Representative Gomez. Of course, we have a bill. She's had that in the comments, and/or is that something have other states directed their commissioner of Department of Health to request those exemptions? Has any of that occurred? Is anybody aware?
I want to say Iowa might be in the process of making that exemption petition. This is not my area of expertise, but maybe one of the legislators that has that bill that might be able to explain it a little bit better than me could explain the petition for exemption piece that we're kind of interweaving with changing federal law.
Thank you, Ms. Schroeder. And we'll take Mr. Teskey. He's got his hand up if you'd like to comment on that before we go to other members. Mr. Teskey?
Yeah, thank you, Senator. I was just going to clarify that in Iowa, it was a third-party, non-legislatively directed petition to the DEA for the exemption, but Hawaii did have a legislative directive to their medical cannabis office to petition the DEA. As far as I know, the Iowa petition was rejected, and Hawaii's petition is currently in process.
Excellent. Thank you, Mr. Teskey. That's helpful. So it certainly is on top of the list.